Welcome to Business Talk Sister Gawk. I'm Becca, and today's podcast episode is how to start a long-term care consulting business. And with me today, I have Denise Monroe. Thanks so much for being with me.
Yeah, of course.
And I am so excited to hear a little bit about what you do. So how about you start with that? Could you tell me what are you doing?
Yeah, so I started my company about a year and a half ago, Long-Term Care Council. So basically, I help people transition into and out of long-term care facilities. I help them be safe in their home and organize their home to allow them to have future goals that are safe and be as independent as possible. I advocate for families when they're going through a tough time with facilities or hospitals. Pretty much I customize packages for really anything they need help with related to case management. So I'm kind of like a private case manager for people.
How did you see this need and why do you do what you do?
So when I started my business, I was primarily working with Medicaid for the last 13 years in long-term care. And those people who accessed Medicaid were all low-income individuals, and they had amazing benefits with that. They had private case managers that would help them with everything, arrange all of their services for them, or give them some sort of direction on how to do that themselves. So self-directed care. However, when you don't meet those qualifications of Medicaid, due to financial stance or functional screening, you don't have any of those benefits. So then it falls all on your family or yourself to complete that. And our healthcare industry is very confusing. So if you're not in it and you don't have experience with it, you really don't know where to start. And most of the time you're handed just a packet of resources and are making about 1 billion calls. So that's kind of why I started this, to make this process simple for people and to help them through the stressful time of planning for long-term care.
Yeah, no, absolutely. It's definitely interesting. And sometimes even qualifying for something like Medicaid comes down to like a single question you may have answered wrong or not with the right semantics, it seems.
Yes, those forms are not easy to fill out. They're very complicated. And so a lot of my clients do have questions about all of the government forms that they have to fill out.
Yeah, absolutely. And so I would like to just ask a little bit more about how do you do what you do? It seems like you have to be very well connected in your community and understand the resources that are there in order to be effective. How did you go about doing that?
Yes, finding the resource is complicated, right? Every different state operates differently um, in association with Medicaid or resources being offered. Depending on your financials, you can access free resources as well. But that took a lot of years practicing, right? And I still don't know it all. I have to do a lot of research to find the resources I'm looking for. And there's a lot of complications with that goes into that. But yeah, it's not something you're ever going to be completely comfortable with unless if there's no additional resources being introduced, which doesn't happen.
Right, yeah, because there's like federal ones and state ones, and then they seem to always be changing based on what legislation is moving and all that kind of stuff, right?
Exactly, and there's new home care agencies and new nursing
Mm.
facilities being
Hmm.
opened, and some are better than others. So I can give that personalized opinion on those resources. I should say the state-funded organizations cannot give their personal opinion on those. So that's the difference between us.
Okay. And what state do you normally work with, or do you work with multiple states?
So I'm right on the border of Wisconsin. So I work with Wisconsin and Minnesota. However, I've lived in Colorado and New Mexico. So if there was virtual opportunities to work with clients there, then I would do that. It would just take a lot of more research on the states that I haven't lived in. But I do think it could be done. Like I said, it takes more effort.
Yeah. Well, and you mentioned I was looking through your website and you had a lot of resources on things, saying, well, things are very siloed and you've seen this to be the case, but how do you make sure that you break down those barriers for people and make sure that they're qualifying for the right things? Like what's your process in that?
Yeah, so I always have an understanding of what their financial situation is. Um, Sometimes people are never going to qualify for Medicaid, even if they shift their assets in a way that their financial advisor recommends, which I always suggest working with a financial advisor so you can look at your long-term care planning
Mm-hmm.
financially. Um, so that's one portion of it, but um, knowing their financial well-being, if they're close to making those Medicaid financial stability, then I would definitely encourage them to apply and go through that whole process. But if I feel like they're never going to qualify, then they need to find a facility that accepts private pay. Sometimes they will eventually qualify for it in, a couple of years after they
Mm-hmm.
drain through all of their funds. Then I would suggest finding a facility that will eventually accept Medicaid with that. So it really just depends on many different factors. Also, you have to look at, any dementia. Is dementia in your history? Then you would have to look at a facility that will eventually offer memory care,
Right.
or
Okay.
so they're not making so many moves. That's very important for the families to really plan ahead and have backup plans on those plans. And so, like, you need to be prepared if your loved one falls. So, do you have a rehab facility that you know of that you would want to go into? A lot of people don't have those plans in place, and that's where I come in to help them with that.
Okay. And what is like the average cost you're seeing for private pay right now? Like on an annual basis or something? Do you know that number?
Yeah, it's very different. It depends on the facility. It also depends on the state. It depends on how large the facility is, how much they're offering, right? Amenities are huge. It depends if they offer Medicaid. So it really is just a huge degree. I mean, I've seen 4,000 a month, and I've seen 13,000 a month, and that's more on the memory
Wow.
care side one.
Okay.
Once you get on the memory care side, it's very expensive. So that it just really varies.
Yeah, no, and that's just something I always like to try to gauge too, because I'm always like, oh, how much does that actually cost? Because I've seen some places that, when you break it down, it's like, wow, that's more than college tuition, and and it's just for a place to live, And I'm sure they have lots of other things too, but it's very easy to see how someone could go through their personal resources very quickly, in those situations.
Yes, it's really heartbreaking to see because you work your whole life earning a salary and saving for to leave something to your children. And then if you're putting to a nursing facility, or if you need if you need memory care, then those funds can go very, very quickly.
Hmm. So when you work with families to transition a loved one, how difficult is it for them to find a placement for care? And what's the average wait time that it usually takes to be able to go from start to finish of applying and being accepted?
So it depends on a lot of different factors. It depends if the family is in a hospital, is the family member in a hospital where they're needing a two-person assist? Did they have a fall and they can't get up by themselves with one person or two people? So that makes a huge difference because facilities are understaffed. Unfortunately, the rehab facilities, they can't get enough employees. So when you have a two-person assist, they're going to be reluctant to take you and admit you. Therefore, that limits your choices, and maybe those very limited choices are not always the best. Um, that can be a factor. Now, if you have a mental health issue on your record from the hospital saying that you've been disruptive, that can also be a factor. Again, staffing can't be prepared for a mental health issue. So it's very sad to see, and that's why I'm called in most of the time to pretty much really advocate for the person and explain their situation versus what a piece of paper says. Because when social workers are sending these requests, they're just sending the documents. They're not calling and really trying to make a personalized approach because they don't have the time. So I get it. So that's when I come in and try to really advocate for the family and get them into a facility that they want to be in.
Okay. Yeah, and I think that kind of answers part of my question, but maybe there's a little bit more that you could tell me specifically around state and county services. Where do most people see themselves getting stuck? And where do you kind of say, here's my advice to keep moving forward in where you're getting stuck?
Yeah, a lot of people um, get stuck in the rehab facility because the hospital is sending them to whatever rehab facility is willing to accept them first. And it might not be the family's preference because it might not be close enough for the family to come visit, which is a huge factor. And then they're being isolated and getting depressed. So that's usually where I come in and try to get them moved into a more appropriate placement. Um, Being that this might be the long-term care placement, so then we have to factor that in. So it really just depends on the situation. But I do see a lot of people that reach out to me who are in the rehab facility.
Okay. So tell me a little about the business side of things. So is this a typical business you could see yourself scaling, or is this something that you say, I have the experience and that's why I decided to o open up this kind of business?
No, I would love to have employees down the line and just run the business side of things. Um, my background is in operation management.
Okay.
Um, in my most recent history, most recent work history, prior to that, I was in case management for 13 years. So I would love to hire employees to really work with the clients. So down the line, I could definitely see that growing, but not too large. I wouldn't want um,
Right, right.
a huge business to run. Maybe 4 to 5 employees.
Okay, yeah. And how do people hear about you? How do you market your business to get out there so that people are aware that it's something that you offer?
Yeah, marketing is tricky. I don't come from a marketing background. So I really base all of my marketing for referrals. So I connect with a lot of local community, um, financial planners, attorneys, um, really anyone in this industry, other social workers, um, nurses, physicians, and I hope that they would think of me when they're getting that panic call from their client saying, my mom's placed in a facility that I don't like, or my parents think they can live alone, but I don't think they're safe. Then I hope that those people would refer out to me.
Okay, yeah. And so do you need any sort of special like degree or training in this type of business?
So in this type of business, not necessarily. When I hire further employees, I would love to have licensed social workers and RNs do that type of work. But since I've had 13 years experience, um, I've had so many life experiences that I don't necessarily need that degree. However, I do have a master's in exercise science as well, and then a dementia care certification as well as a brain injury specialist certification. So moving forward, the answer, I guess, would be yes and no.
Okay. Right. Yeah, so then with the services that you offer, is any of it like have you partnered with any governmental organizations at any time to subsidize part of it, or is this all something that individuals do out of pocket?
They do this out of pocket right now. I would love to see people utilizing their HSA benefits as well, since it is a healthcare need.
Okay.
But they would have to reach out to their employer for that clarification. I have not partnered with the government yet, but I do partner with the local ADRC here in Wisconsin. That's the Aging and Disability Resource Center. They're amazing, and they refer out to me as well. Um, but not at this time. I haven't applied for any grant funding or anything like that.
Okay, yeah. So if you were to advise someone on how to set up this type of business, what would be the first thing you would tell them that this was valuable and you should really consider it?
I would tell them to do a lot of research prior. So talking to other business owners was incredibly helpful to me. Um, when setting this up, and they have all of the advice, and they're always willing to talk too. So I picked as many business owner brains as I could prior to setting this up and really gave it some thought to make sure that I was doing everything correctly from the start. And then I also took a business class at the Wisconsin Small Business Development Center, and that was very helpful too.
Mm.
So, and there's free resources out there for you in almost every different state for small business owners, especially women.
Okay. Yeah. And what do you think is the biggest barrier to getting started with this type of business?
I think it's hard to get your, I think it's hard to get your name in the community. Um, there's a need out there,
Hmm.
definitely, because I see people struggling with this all the time and so stressed out. But it's hard to explain what I do because it is so niche. And it's hard to get my name out there where everybody understands where to go if they need this help.
Mm-hmm. Yeah. So what do you think of like what you're learning right now in terms of with growing your business and seeing new things coming out within your industry?
So there's so much to learn in the healthcare industry. So much changes every single year that I do a lot of research, a lot of educational seminars to keep up on all of the changes, um, a lot of networking with other professionals in the field. So I would say that's very important right now. Well, there's a lot to learn in my industry. So right now I'm learning about the insurance aspect of it. So private insurance, life insurance.
Okay.
I'm looking to get licensed in that and then move forward with Medicare as well to try to really figure out the ins and outs of that, the insurance aspect. I know a lot, but I'm not licensed yet. So that's what I'm working on next to really understand the changes so I can be on top of it year to year.
So what do you mean by license? Like you would offer insurance or you would be able to work with someone's insurance?
In the future, I may offer insurance, selling insurance as well,
Oh, okay.
as just on the side. My primary focus is this business and be a consultant and a private case manager for people. But I do want to stay educated on the insurance side of things so that I can direct people in the right way,
Right.
especially
Okay.
with Medicare, where it's incredibly confusing for people.
Mm-hmm. Yeah, it's super interesting too how this is a side comment, but I was talking with a doctor recently about well, you could have this surgery or do this for certain people, but you can only do it if you're have insurance through this specific state. Like I think it was like North Dakota or something says this code they'll accept for surgery, but the same code in another state won't accept it for surgery. And it's like very interesting how specific it is by system and insurance company. So, yeah.
Exactly. It's a lot for a person in distress to navigate.
Hmm.
So you don't understand that you can only be in the hospital for a certain amount of time, and then you're going to owe a certain amount of money if you have Medicare, or maybe you have that supplemental. So it it gets very confusing for people. So I just want to stay on top of all of those rules so that I can direct them in the right way.
Yeah, absolutely. And so, with that being said, when you're talking to people who are exiting the hospital and all of that, do you have any kind of like tools or software, anything like that that helps you stay organized and help your clients feel that they're prepared?
So I'm just not at the scale yet where I'm overwhelmed by clients. I wish for that success in the future. There is case management systems that I could use, but I'm very thorough in my email communication with them, so they have everything in writing of what they need to expect and where to go from there. Most of my clients I see for 1 to 3 months. Some other ones I'm with them for their whole lives, because those are the ones that
Mm-hmm.
are disabled but independent in their household. So I'm more managing their household. So I'll be with them for a long time. So when I'm trying to put together a plan for the future, let's say they're in a rehab facility and they want to go into an assisted living eventually when they recover and do all of their therapies, then I put a plan into place, like what facility what assisted living are you going to look at? What are your wants? Do you want a small facility? Maybe one with more activities? Those kind of things. So I put all of that into a plan for them so they understand exactly where to go from there.
Mm-hmm. Well, and I'm sure that helps to really bring down the overall, like the feeling of being overwhelmed and trying to navigate the options. Because I'm sure there's many that you can choose from, but knowing how to narrow it down to like these are the ones that are going to be a good fit for what I'm hoping to do seems like a really
Exactly.
helpful thing.
Yes, exactly, because there is so many out there. So I try to narrow it down to two or three options so that they're not overwhelmed by options and they can go and tour those facilities and compare them to each other and get their personalized opinion on that. It's always important to tour the facility before you make a decision. I mean, that you would think that would be simple to say, but a lot of people don't. They just make the decision off the website, and it's important to get that feel.
Yeah, no, that's a really good tip as well. Because you're right. I think a lot of people like same thing with buying houses now. People don't even go and look at
Oh
them.
my
They just look
gosh,
at the pictures
true.
online and they're like, yeah, that's
Without
where I'm
an
going.
inspection.
Yeah. Yeah, for sure. Well, tell me how people can find you.
So I have a website as well as my phone number is 715-690-9600. And then they can go to my website and just go to contact me, and then they type in all their information and then I call them. I always call people within 24 hours and you can have a free consult as well.
Awesome. And that website is longtermcarecouncil.com.
Yes.
Okay, just wanted to make sure. Awesome. Well, I'm going to transition into the gawk portion of this episode.
Wonderful.
And since we were talking about caregiving and all of that, I decided I was going to tell you a story. And so my grandpa lives with my parents, and he a couple years ago had a pretty significant fall. So he has some like TBI or traumatic brain injury with that, where not everything like you tell him is sticking, sometimes. And he
Mhm.
gets around okay, but sometimes he just forgets things like how much he ate or did he already eat or like stuff like that. And so my brother was home with him recently, and he called me to tell me this story, and I was just laughing so hard because it was just such a classic thing that my grandpa would do. So my brother was like, "Oh, I'm gonna make you some food, so you just sit at the table and I will work on doing that." And I love my grandpa. He cracks me up because he's just kind of like enjoying his time waiting. And my brother made an entire like batch of pancakes, and he was like working on flipping them and everything. And as he was making them, he was just putting them on the table on this like plate in the middle. And when he was finally done with like the last pancake, he comes in and there's nothing on the plate. My grandpa had eaten every single pancake.
How many did
And
he make?
well, I don't think it was like a ton. It was like probably a stack of like six or eight or
That's
something.
a lot.
But that's a lot. Yeah. And my brother was like, I was making pancakes for you and me. And he was like, well, I thought these were all for me. And he was like, I was wondering why you kept bringing them. And so my brother was like, so I had to make something else for myself. But it was just so funny because I was like, this is such a classic thing my grandpa would do. To
I
be
think
like,
your grandpa just was doing what he was told.
yeah. Yeah. I mean, to be fair, like it was in on the table and he didn't say like this is for both of us. So
Yeah,
but yeah, I was like, wow, that's a lot of pancakes. So
that's very funny.
anyways, that was a random moment from my courtesy of my brother Micah. So
Wonderful. I'm sure they both got a good laugh out of it.
yeah, and I'm sure like he did not want to eat dinner that night.
Probably
Be
not.
yeah. Well, thank you for joining me today. I really have
Yes, of
appreciated
course. Thank you
hearing
for
all
having me.
about, yeah, hearing about all about your business and what you're doing. And I would love to hear from you all as you listen to this episode. If you enjoyed it, you should give it a review on wherever you are listening. And I'll see you next time.